All right, let's jump right in. Today, we're talking about something that honestly sounds like it's straight out of a sci-fi movie, a special glue for mending broken bones. Yeah, you heard that right. And this could genuinely change everything about how we heal.
Think about it. When someone has a really bad break, what's the first thing that comes to mind? Probably metal plates, screws, maybe some rods, right? For the longest time, that's just been how it's done. But what if there was another way? Something less invasive, maybe a little more natural to piece ourselves back together?
Well, it looks like a research team in China might just have that answer. They're calling it Bone-02, and it's basically this new bone glue. The idea is to do for our bones what superglue does for a broken vase. But, in a way that's much, much smarter and safer for our bodies.
Okay, so let's get into the details here. What is this stuff, really? And how in the world does it work inside the human body? So at its most basic, Bone-02 is this super specialized adhesive. Just picture a powerful medical-grade glue designed specifically to bond with bone. Its whole job is to take those fractured or even shattered pieces and just stick them back together so your body can start doing its healing thing.
And this is where it gets really cool. The magic, right? First off, it's designed to work perfectly in the wet, messy environment of a fresh injury, which, believe me, is a huge challenge for most glues. But the real game changer? It's bioabsorbable. What that means is after the bone has healed up, the glue just dissolves. It gets safely absorbed by your body. The most important part of all this, no second surgery to pull out metal hardware. That's huge.
So, an idea this incredible, where does it even come from? Well, as it turns out, the scientists behind this didn't have to look much further than the world right outside their window.
I mean, you gotta wonder, right? How do you even start to create a glue that's strong enough to hold bone together inside the body, but also safe enough to just disappear later on? The answer is, well, it's pretty brilliant. They turned to something called biomimetics, which is really just a fancy way of saying they learned from and copied nature. For Bone-02, the inspiration came from mussels. You know, the shellfish? Have you ever tried to pull a mussel off a wet rock at the beach? It's practically impossible, right? They create this unbelievably powerful glue that works underwater. So scientists studied that natural wonder to create a glue for us. And this brings us to just how fast this whole thing is. We're talking about a bonding process that's incredibly quick. According to the early reports, it can set shattered bone fragments in place in just 2 to 3 minutes. Wow. So the whole process is just beautifully simple, really. A surgeon applies the adhesive to the broken pieces of bone, presses them together for a moment, and bam, within minutes, they're bonded. Then, as your bone naturally heals and gets stronger over time, the glue just kind of fades away. Gone. Okay, so what does this all mean for an actual patient? What are the real-world benefits this technology could offer compared to the stuff we use now? Let's just put it side by side for a second. In one corner, you've got the traditional metal plates and screws. That often means longer, more complicated surgeries, and then there's always that chance of another surgery down the road to take them out. Now, in the other corner, you have Bone-02. It's offering a potentially faster, simpler procedure, and, this is the big one, no removal surgery needed ever. And this is where it could be a total game changer. We're talking about something called comminuted fractures. These are the really nasty breaks, where the bone shatters into a bunch of little pieces. Trying to put that back together with screws is like a super high-stakes jigsaw puzzle. But a glue could be the perfect tool to put all those tiny fragments right back where they belong. Okay, but as exciting as all of this sounds, it's really important to take a step back. We need to keep our feet on the ground here and look at the reality and, the current limitations of this tech. Look, this is a seriously promising development, no doubt about it. But it's also crucial to understand that Bone-02 isn't about to replace every plate and screw in every hospital tomorrow. There are still some pretty big hurdles to clear. So while we hear reports that it's been used in about 150 patients, the next really big step is extensive, peer-reviewed clinical trials. And these aren't just a formality, right? They're needed to track long-term performance. We're talking about things like, how's the bone density at the repair site? Is there any risk of an allergic reaction? And how does that bond hold up after years of use? Plus, it's not a one-size-fits-all solution. For a lot of fractures, especially the ones that need major structural support, metal implants are still going to be the best choice for now. So, keeping all those limitations in mind, what's the bigger picture here?
What could a technology like this actually mean for the future of healthcare, not just in one country, but around the world?
Well, think about healthcare systems where complex surgeries and follow-up procedures are really expensive or just hard to access. In places like that, a simpler, more affordable way to treat fractures, that could be absolutely revolutionary. It could mean much better outcomes for a whole lot more people. But getting there isn't so simple. Any new medical tech has to go through really tough local approval processes. The cost is going to be a huge factor. And of course, long-term performance data is absolutely crucial. Not to mention, doctors and surgeons would need to be trained on this whole new technique. So yeah, the road from a lab in China to your local hospital, it's a long one. But it's definitely a journey worth watching.
Bone-02 is just a fantastic example of how looking to nature can help us solve some of our most complex problems. It's not a magic bullet. Not yet, anyway, but it represents a potential shift in how we think about orthopedic surgery, moving away from just hardware and more towards regeneration. And it leaves us with a pretty fascinating question to think about. Are we on the verge of a future where we can simply glue ourselves back together?